Dr. Ellegala, you're a board certified neurosurgeon. I want to know, what's your clinical take?
Well, Nolan, my take is get second opinions and travel for the best care.
And why do you think this?
Look, look at anything else that we do in life. We, when we go on vacation, we look online, we look at ratings, we look at places. When we shop for a car, we do our homework. We go test drive the car even before we buy it, right? And here, especially for surgery and especially for neurosurgery, here you are about to undergo a surgical procedure that you cannot undo. Once the surgery is done, it's done. And whatever consequences come from that are there. And, and yet we don't really often know who our surgeons are, whether we're comfortable with them. Perhaps just somebody that we've just been referred to, and that's about it. And it's our first meeting. But if we did the same kind of due diligence and the same level of comfort with the surgeon that's about to operate on us that we did with most of the other things that we do in life, I think our patients would have a better outcome, but also they'd be more comfortable. They would have found a match. Not every surgeon is the same. Not to say that one is better than the other, but it's really kind of like dating. You date, you find somebody that you click with, you trust them, and there's a great relationship. Same thing with your surgeon. You need to find somebody who's competent and good, but then also somebody that you click with based on your own personality, your own needs, what you're looking for, and see if you click, because it's a relationship that can last for years.
I've always said that if I were getting my AC replaced, I would get a quote and then I'd immediately go out and get a second opinion to see if that first quote is even reasonable, right? And
Hmm.
it's not any different with your care. I feel like with surgery, you're saying it from a surgical perspective, but I also feel like from a diagnosis perspective too, if you feel like something isn't right with your diagnosis, that's worth a second opinion too.
Absolutely, and I wouldn't even wait for the diagnosis. Especially if you're going to see a primary care physician, that that doctor is your partner for your life, and so you want somebody that you're comfortable with, that you can ask questions, that you feel hears you, because that's so important for great care, but also peace of mind and well-being. You know that this is the right person taking care of you.
As specialists, we think of our job is to fix one specific thing, but that relationship between a primary care doctor and their patient is even more intimate. And I get what you're saying. I also
Absolutely.
I can say honestly, I've had it happen to me in the past where I've done exactly what I thought is 100% right for the patient. I've done all the appropriate workup. I've looked at them and I said, this is exactly how I'd treat a family member. And they say, I want to go get a second opinion. And you really have to be humble in order to accept that and be like, yes, here, I can send you, I can refer you to somebody that's good. Right.
Hmm. Uh, I think sometimes it may hurt our egos, but it's, and not to criticize what you just said, but part of it is our ego should not be based on if the patient stays with me or has surgery with me or is my patient. Um, our ego should be based on, is the person sitting in front of me going to have the best care possible for them? Doesn't mean that I'm not a good doctor or not a good surgeon. It just means, is it the right match? And it really is kind of a match.
I've thought about this too from a post surgical standpoint. If someone knows and gets a valuable opinion from you and they go get a second opinion with somebody else, and that person also gives the same opinion, if they come back to you for surgery, regardless of how it goes, they're going to have a better experience. They're going to feel more comfortable with the outcome.
They're empowered because they just made a choice. And a lot of healthcare, when you're the patient, is losing your power, is being vulnerable, is being ill, having somebody else who knows more and is taking charge of your life. And frankly, can impact your entire family's life. Um, and so if you as the patient have looked at multiple options and then have chosen, that's a very powerful thing for the patient to do. And really good for you as the physician or surgeon as well. Here's somebody who's done their homework and they're with you. That's great. And if they choose somebody else, that's wonderful. They've made the right choice for them. That's all that matters.
Why do you think you feel so strongly about empowered decision making from patients? I mean, you could have brought any opinion onto this show, and this was your opinion. Why is that?
I think it has a lot to do with. I think people are happier and they do better when they have a semblance of control over their lives. And when you become ill with whatever it is, you all of a sudden have lost control of one of the most vital aspects of your life, your health. And this is not something that's often talked about. It's not. We don't. I didn't ever study this in medical school or learn this as a resident or in my training. It's just something that I've come to over the years. And I think it should be talked about. It should be something that is part of a patient's decision making process.
Do you have any specific like clinical examples that when you think of empowering patients, is there any one that just jumps out? And obviously we have to keep it anonymous, but is there anything that jumps out to you where you just go, yeah, this is really something that sticks with me even after a lot of time has passed?
Yeah, there was a patient. This is quite a while ago, but I still remember this. It was the wife of a well-known individual in the community, and had a brain tumor, and had seen a well-known neurosurgeon. Was told, "You've got 2 months to live, and so enjoy your life. There's really nothing to be done." Um, she ended up coming to me. We ended up doing surgery, but then she also went to, and I helped facilitate her getting opinions and traveling for care to the best places possible. So I won't name the institutions, but she went to a well-known institution in New York for her radiation therapy. She went to a well-known institution in Boston for her chemotherapy. She went to a place in Germany for alternative medical care. And and along the path, they would send me messages to let me know where they were in their journey and what they were doing. But she had a year and a half of high quality life with her family, where they were traveling, doing all the things that they had talked about doing and hadn't had time to do. And instead of dying after 2 months of the diagnosis, she lived a normal life for 18 months. And then over a period of 5 or 6 days passed away. But that family still to this day remembers the fact that they had all this extra time with their loved one. And so that's an example of somebody who, granted, they had the means to travel, they had the means to do things, but it doesn't mean that you can't use your insurance and go to a doctor of your choice or a clinician of your choice.
It seems like that patient had a year that will be remembered by their family members forever too. It only sounds like a
Yes.
year, and a year to us who are healthy doesn't seem like that long, but in that situation, I can imagine how much of a difference that made for everyone in that family.
Yeah, and also, what I got out of talking to her husband and some of the family members is, again, that they had that sense of empowerment that somebody else didn't say, too bad, you've got a couple months done. They were able to take some control into their lives and look what it got them. And I think that sense of there is something I can do. At least I can choose whether to do something or not. That in and of itself, I could tell made a difference for them.
Yeah. And you've had an experience not just with patients traveling to get care from you, but you traveling to provide care to patients, specifically
But,
in Africa. Can you tell me a little
well,
bit about how that happened? I mean, how does someone end up doing brain surgery in Africa?
it was really not a planned. thing. I wanted to take a break from what I was doing after my training. I spent 6 months in East Africa, saw a need, um, two neurosurgeons for 45 million people at the time, no MDs at most of the major hospitals. And then, I saw Westerners with very good intentions coming in and doing the work themselves, spending a week or two at the site. And I thought the problem with that is it creates or it propagates dependency. And so I actually didn't. I only did one operation as the primary surgeon. In now it's been 20 years of doing this work. Uh, every other one has been me teaching somebody or seeing one of my trainees teach the next generation. And so it's again that sense of empowerment. It's in this case, it's not empowering the patient, but empowering the clinician or surgeon to be able to do much more than they were able to, and at that time even thought possible. And yet now, if this was Tanzania in 2006, now 20 years later, there's almost 32 neurosurgeons, two neurosurgical training programs, and they don't even really need me or us anymore, which is wonderful. That's exactly what we want.
So take me back to 2006 in Tanzania. You're going there. I'm assuming you're thinking this is going to be a little bit of a glorified vacation or adventure.
Yeah, absolutely. That's
Okay.
exactly. That's
And
exactly what it was.
and what happens that takes you off that hard off ramp into brain surgery?
I think it was seeing the need. Patients that had horrible neurosurgical problems, brain tumors coming out of their skull, little babies with untreated hydrocephalus, which is water in the brain, um, and and part of it is also I think I'm also a workaholic. I need something to do. And it's a I need something to do, but then also I want to make a difference. I want to help my fellow human. And we think of being doctors here in the U.S., but when you're a doctor, you don't take an oath to be a doctor in a country or a nation state or a county or a city. You take a oath to be a physician to your fellow man. And so our patients are everywhere on this earth. And
And
so it,
you said
mhm.
that you did one surgery, right? What
I
happened
did
with that one
one.
what happened with that one surgery?
So I did one surgery as the primary surgeon,
Huh.
and with the person I was training, who at the time was not a doctor, assisting me. And then every other one after that, he did, and I assisted him. And then I went back the next year, uh, taught him how to teach. He taught the first local MD. And that process kept on going to the point where um, they're they're really, I would say, the goal from the beginning was to be wanted always, to be needed never. And I think we're probably there.
When you had this one surgery, um, I heard you use some interesting equipment.
Yeah, you use wire saws to remove to make a window in the skull to get to the brain. In some of the cases that we did, we had to cut and make our own plates and screws to fuse broken spines. Um, and it was either that or the patients died at the time, and so there was really no other option.
So when you started there, were you like, if I can just teach one or two high yield procedures, the potential impact is saving numerous lives. And so, who was the first person that you taught to do this? And is that what you did? Was that you focused on these like really, doable high impact procedures?
No, that's a good question, but nobody's ever asked me that. But no, what I actually focused on was the individual. The people are the key, and the procedures and the procedures are not actually the critical part of it. So it's it's identifying somebody with the passion and the desire to do it, to learn, somebody who is committed and wanted to help patients in their community and their hospital. Um, And so it's really identifying that one key individual that will make that difference. And then and I didn't actually limit what I taught. I started with teaching basic brain and spine surgery. The following year, I went back and spent 6 months teaching him how to teach, but also doing more complex brain tumors, pituitary tumors, um, things that maybe you wouldn't think about doing in a region of the world like that at that time. And it was successful. We kept outcomes data. So I was a university neurosurgeon. So I kept data. We had students and residents going, and we objectively quantified the outcomes to make sure that we weren't doing harm.
And it seems like you've had to bring something back to the United States where you learned about yourself, where you learned about teaching, that's then made a big impact here as well, right?
Yeah, I like to think so. It certainly made a huge impact on me. Yeah, uh, it gave me a broader perspective on what I do, who I was, the world in general. But every young student or resident or doctor that I've gone with, I would say they come back saying this has changed their lives, their view of things, and I see it. A young neurosurgeon from the U.S. who goes and spends time there and comes back, yeah, they're not flustered by anything here. Um, uh, Usually, they come back kinder and more patient as well. It's very interesting. I did. I was very impatient when I went. It teaches you the what's important in life, I think, too. So I would say I've gotten as much, if not more, than I could ever possibly have uh, passed on
That's
in
like
other
any
parts of the world.
that's like any charity thing though, right? I mean, I feel like anytime you donate your time or your expertise to a charity or a charitable cause, you end up getting more in the emotional dividends towards yourself than anything, right?
I think that's true. I hate to say it, but it's always a selfish endeavor to a large degree.
All right, so we got that you're a workaholic. You did this thing where you've impacted countless lives and created a whole neurosurgery program in Africa, and you did this all because you're a workaholic and you're selfish, right? That's what I'm getting out of it.
That's exactly it.
Yeah.
What it comes down to is exactly right.
That's
There's one other
amazing.
part. I get bored easily, so I need something to as the next challenge.
I agreed. I think all of us are a little bit like that, right?
Yeah, I think
Yeah.
yeah, absolutely. Most physicians are, and most people in who are high achievers in whatever field they're in are probably like that.
Yeah. Yeah. That's incredible. So if you were to look at patients and if you were to have a billboard announcement, you would say, "Hey, go get a second opinion if you're going to if you're going to find a physician, get a second opinion and find a physician that you bond with because that's going to ultimately empower you and, make you have the best possible experience."
At, exactly, and then travel. You travel for the care. Don't let distance inhibit your decision. It may
Yeah.
be a factor in the decision, but don't let it inhibit
If you have the means, travel, seek out the
if
best.
you have the
And
means.
yeah, and I also feel like, if you travel for care and you just get the same opinion at a different place, then you're willing to say, I don't need to travel for care. I've already empowered myself.
Exactly.
Yeah,
And if you get a different opinion, then you're seeing the nuances of medicine and understanding whatever is happening with you better.
that's awesome. Well, hey, you nailed the show, Second Opinions. And all I have to say is that if you're a patient and you're listening to this, I want you to travel for care and I want you to get a second opinion. And Dr. Ellegala, thank you so much for doing this.
You're welcome. Thank you for having me.
Awesome. This is Second Opinions. We'll see you next week.